So today we'd like to talk about the features of what would be the ideal primary wound dressing. So we think of things like being sterile, being bacteriostatic, and being inert. We want something that would be transparent so you can see wound progress, something that's odorless, something that's structurally and biologically stable. Thinking about it being easy and painless to apply and to remove. We want something that's suitable for different skin types and different locations, as well as different wounds. We'd want something to be full contact, so it's in full contact with the skin, and something that ideally would mimic intact skin. We want something that effectively reduces the acute inflammatory responses from things like lasers, and ideally it needs to be gas permeable. It needs to be hydrating, but not to be too hydrating as to macerate. We need something that's chemically stable and mechanically comparable with other secondary wound dressings, so to absorb exudate, for example. So in line with that, silicones are an excellent material. And we've been using silicones for many years, but with the new range of film-forming silicones, we have additional advantages from the gel-applied dressings. So features, for example, like the gels are bacteriostatic and they're inert, so they don't react with the body or with other mechanisms. We want something that's fast drying, so applied as a gel, but then dries to form a silicone gel sheet. Something that's gentle with its adhesion, so if, for example, if it's adhering to granulating tissue, but something that you can also remove quite easily. We want something that obviously is bacteriostatic and helps prevent infection. So the range of silicone gels that we have are specifically designed for different types of wounds and to be used in combination with secondary dressings, or in circumstances where you just want a primary dressing, a full contact, gas permeable primary dressing.
I'm Leonardo Marini from Trieste, Italy. I'm the medical director of the Skin Doctor Center of Trieste. And I've been using Strattamed since almost 5 years with great satisfaction, both on my side and on my patient side. We want something which is able to have 100% contact on this irregular surface. Yeah. This is what I like of this kind of silicone.
Mm-hmm. Mm-hmm. And Dr. Benedetto, could you
my name is Anthony Benedetto. I'm from Philadelphia in the United States. I'm the medical director of Dermatologic Surgery Center, and I've been using the Strattamed products for about a little over 2 years, maybe almost 3. I have been impressed by the way resistant wounds have healed within a matter of days or weeks.
And how much faster, or how fast do you see the results, or how would you quantify?
Well, a wound that was persistent and not healed and not reepithelialized for 2 years, and after 2 weeks to less than a month, it totally healed and reepithelialized, really meant something. It told us that something was not right prior to applying Stratamed, but yet it was normalized,
Yep.
Stratamed normalized the healing surface, and it allowed the skin, the epithelium, to just grow and
Yep.
connect over the wound.
So this is in a recalcitrant wound, a slow healing wound.
Yes.
But
Yes.
what about in maybe other dermatological procedures, surgeries, different types of lasers? What sort of experience do you have with the products?
With Stratamed, we can really be on the safe side because, as you said before, it's bacteriostatic, and it's sealing, protecting this wound, a surgical wound. Usually, in surgery, we use ointment, and they're thick, and sometimes they macerate the tissue because ointments are not semi-permeable, so they are occlusive.
Yep.
So I prefer Stratamed because it's semi-permeable, and the film it forms, it's very thin.
So you have the Stratamed in the theatre with you, and then what? The patient takes that
Yes.
with them. Yeah.
And then, instead of using a topical antibiotic, where now there's a lot of contact dermatitis, a lot of problems with using different types of topical antibiotics, we give them the Stratamed, which is inert. It doesn't promote any bacterial growth, so it acts like an antibiotic.
Yep.
And it really hastens wound healing.
Yep.
It's amazing.
So in terms then maybe of the protocols that you had previously and what you're doing now, what changes? Just this first contact?
Just the topical ointment. Instead of an ointment, it's now a silicone gel. A silicone gel that's much more effective, and it just promotes the healing much better with less danger for contact dermatitis, less danger for irritation, but it promotes healing more so than any other type of contact antibacterial ointment that I've ever seen.
And using for incisions, for lasers, for...
Anywhere where there's no epithelium.
And the patients, do they have symptomatic relief? What do they experience from the gel?
They don't feel this warm effect of the Vaseline or that we usually use because of the occlusion. Vaseline is occlusive, and Stratamed is semi-permeable.
Yes.
So they feel protected. They feel like normal skin. So a little bit of burning sensation due to the fact that, of course, the process was done, but they feel much better. And very important, very unique feeling after fractional radiofrequency, for example. If you put Stratamed immediately after the procedure, they feel relief because it's sealing 100% the surface of the skin.
So, and I want to add to that the erythema. That sometimes we use topical steroids, like with photodynamic therapy. It's another non-ablative way of rejuvenating the skin and eliminating precancerous changes and solar elastosis, which is skin damage. And we have done studies where we applied Stratamed on one half of the face, and we usually did it on the face, and then a very potent, the highest potent steroid on the opposite side of the face. And within the same amount of time, Stratamed has eliminated a lot of the itching, a lot of the burning, and it has helped with the desquamation just as well as or better than the class 6 topical clobetasol ointment. So it's as powerful as the strongest topical steroid on the market, and the patients feel it. They volunteer saying that it's less heat producing. The heat is not, or the sensation of heat and itching is not as severe as it is on the side where there's the topical steroid. So it's a soothing kind of healing process.
Great. So easy to use, comfortable for the patients, prevents infection, and it sounds like very utility-wise very well across many procedures.
Absolutely.
And you don't need much because the spreadability of this device, medical device, is fantastic because silicone finds its way to resurface the skin in a unique way. because other primary dressing, they don't do this. You need to use a spatula, and you need to spread, and this is very irritating to for the patient. So silicone is finding its own way. So it's very, very good.
Excellent. Well, gentlemen, thank you for your experience.
Our
thank
pleasure.
you.
Thank you.